Welcome to the state of Ohio. I'm Karen Kassler. Nearly 99,000 low-income Ohioans who got birth control and reproductive health care services with the help of federal Title X funds have fewer options now. Planned Parenthood nationwide is rejecting Title X money, saying the Trump administration's new rules on it restrict the doctor-patient relationship. Planned Parenthood served more than half of those patients, and in 9 counties, Planned Parenthood is the only provider that accepted Title X funds. State House correspondent Joe Ingles has more on the impact of Planned Parenthood's decision.
Athens is the poorest county in the state, according to Ohio's 2018 poverty report. It's also home to one of the largest universities in Ohio. And while students there are often covered by their parents' health care plans, some of them have turned to the local Planned Parenthood for low or no-cost services subsidized with Title X funds. Former OU student Emma Schultz says she and others she knows have gone to Planned Parenthood because they want the privacy it offers when accessing birth control options or STD testing.
If their parents are not approving of them being on birth control or being sexually active, then it can be very scary to disclose that information to your family. And I believe that everyone has the right to that kind of privacy. It's also in a situation where maybe a partner could find out about things, and if you're in an abusive relationship, there are confidentiality issues, and everybody deserves to feel safe.
But this Planned Parenthood in Athens, like all others throughout the country, will no longer be getting those federal Title X funds. The national organization said it couldn't comply with what's being called a gag rule from the Trump administration that prevents doctors receiving those funds from talking about abortion with patients.
Effectively, it limits the ability of a doctor to have an honest, comprehensive conversation with their patient. Planned Parenthood will not comply with that kind of restriction.
Planned Parenthood of Greater Ohio had previously received about $4 million from the federal government for its non-abortion services, including family planning, cancer screenings, and basic health care. 2 of the 19 offices Planned Parenthood operates in Ohio offer abortions, this one in Columbus and another in Cleveland. The Athens clinic can refer pregnant women to those 2 clinics, but a clinician there says it's rare.
We see by far more patients for birth control options than unplanned pregnancies by far. There's no comparison.
The Athens clinic, like the other 17, offers birth control, screenings for cancer or sexually transmitted infections, and more.
Our clinic rolled out, along with HIV testing, the preventative prescription for HIV called PrEP. Rolled that out to all of our clinics statewide this summer. Of all of the clinics, the Athens clinic in the first week saw more patients for that service than any of the other clinics.
State lawmakers defunded Planned Parenthood a few years ago, taking away about $1.5 million in annual support for birth control, HIV, and STD testing and cancer screenings. Now that there won't be federal funds to help provide those services, patients without private insurance or Medicaid will have to bear more of the cost through payment plans that have been established to help ease the burden. Still, some patients might find it difficult to get the kind of care they need, though the organization says it will continue to do its best to serve everyone.
We also have a fund that can help to maybe write off the cost in certain situations. If there's any sort of unsafe situation for our patients, we might really lean on our community funders to help our patients out.
But those who back the new federal rule that precipitated Planned Parenthood's decision to drop out of the program blame the organization for its decision.
They could still be seeing these people today, yet they choose to make sure that they're focused on the abortion side of their business, which is their biggest moneymaker, instead of the others. Now, fortunately for the rest of us, there are hundreds and hundreds of community health centers, local departments of health, minute clinics in every Kroger, Walgreens, Rite Aid, CVS. There are plenty of options for women.
Planned Parenthood says it was the only Title X provider of its kind in Athens and 8 other counties that offer those comprehensive services.
You know, Planned Parenthood clinics see 64% of the patients statewide who receive Title X funds. 64%, so hold that number in your head. We are only 21% of the locations that get Title X funds. So we see most of the patients, but we are about 20% of the locations.
There is not a community, a county, a city of any size in Ohio that doesn't have multiple options for individuals to get access to contraception or to get access to any other types of health care via Title X or anything else. There just simply isn't.
And while health care is the issue, Democrats point to Republicans and the Trump administration for causing the problem, and they say political action is the cure. They're lining up behind the organization that uses pink as its signature color, hoping voters will react by turning the White House and the Senate blue. Jo Ingles, State House News Bureau.